Hello there, I'm Kate Smiles from the Mind Body Reset, and I'm here today to talk to you about adult ADHD. Now, ADHD in adults seems to be on the rise, but we're not starting to develop the condition later in life, as generally sufferers become symptomatic before the age of 12 and in many cases below the age of 6. So it's a long-standing trait that may only be noticed in adulthood or may have recently worsened. Classically, symptoms are classed as either inattentiveness or hyperactivity impulsiveness. In adults, though, the symptoms of ADHD are more difficult to define, as obvious hyperactivity may decrease while stealthy inattentiveness tends to remain. Symptoms of adult ADHD are thought to include carelessness, lack of attention to detail, continually starting new tasks before finishing others, poor organisational skills, inability to focus or prioritise, continually losing or misplacing things, forgetfulness, restlessness, edginess, difficulty keeping quiet, speaking out of turn, blurting out responses, interrupting others, mood swings, irritability and a quick temper, inability to deal with stress, extreme impatience, time management issues and risk-taking, often with little or no regard for themselves or the safety of others, for example driving dangerously. The cause is not fully understood, although a combination of factors is thought to be responsible, most notably genetics, brain function and structure, plus risk factors. Genetics. ADHD tends to run in families, so the genes you inherit from your parents are a significant factor. Brain function and structure. Studies involving brain scans have suggested certain areas of the brain may be smaller in those with ADHD, whereas others may be even larger. So it is thought that sufferers may have an imbalance in their level of neurotransmitters, or that these chemicals may tend to fail. Groups at risk. Individuals who were born prematurely with a low birth weight, who suffer from epilepsy, and those with brain damage, either in utero or after birth due to a severe head injury, are thought to be most likely to develop ADHD. Diagnosis in adults can be challenging, especially if you don't have anyone who knows what you were like as a child. But if you have 5 or more of the symptoms related to inattentiveness or hyperactivity impulsiveness, and your symptoms are having at least a moderate effect on several different areas of your life, such as underachieving at work, in education, driving dangerously, difficulty making or keeping friends, and difficulty in maintaining relationships with partners, then you may be able to be referred to an NHS specialist or even self-referred to a private clinic. If your symptoms are more recent, so didn't occur regularly in the past, you may not be diagnosed, as it's currently thought ADHD can't develop in adults unless they have suffered from a traumatic brain injury. However, while stress is not considered to be causative, it can trigger an increase in symptoms that were previously expertly masked, thereby giving the appearance of a new onset. Treatment can help to make the condition much less of a problem day to day via medication or talking therapy, but a combination of both is generally best. Medicine doesn't offer a permanent cure, but may help sufferers concentrate better, be less impulsive, feel calmer, and learn and practice new skills. It's important to let your GP know if you experience side effects or have medication concerns. Therapy such as psychoeducation, behaviour therapy, social skills training and cognitive behavioural therapy can also help with symptom management. Self-care is always worth consideration, but should be overseen by your medical team. Advice may include diet and supplements. Diet-wise, it's best to eat a healthy, balanced diet. It may also be helpful to keep a food or symptom diary to help you notice any links between a specific food or drink and your behaviour. Then discuss this with your specialist. Supplements like omega-3 and 6 may be beneficial, although the evidence supporting this is currently limited. Do check with your doctor re-medication interactions beforehand. Other options. As stress is a known trigger, stress management is a very important consideration, so do explore the following to see if you might benefit. Gentle exercise in nature, breathing exercises, mindfulness or meditation, gratitude practices, affirmations or emotional freedom technique, and journaling. Plus, why not consider sentimentology, a blend of hypnotherapy, guided visualization and lucid dreaming, to see if this will help you calm your mind and improve your focus. If you're a busy woman with health concerns, please join my private Facebook community, the Mind Body Reset group, for lifestyle advice, health swaps and self-care information. Thank you for watching. I hope you found that useful. Bye bye.